Before you have surgery, it is important to prepare your home for your return from the hospital. In this brief video, I will highlight a few ways to ease your transition home and help maximize the recovery process. Prior to surgery, you may consider preparing meals that can be frozen and easily reheated. You should also assess your home environment for safety hazards and items that may impede your ability to move throughout your home. You will want to ensure that you have clear pathways throughout your house. Furniture should be rearranged, and the hallways and floors should be free of small objects, such as toys, electrical cords, small throw rugs, and runners. By removing these items, you are eliminating potential trip hazards and improving your ability to move from room to room. You may also consider placing night lights from your bedroom to the bathroom to illuminate your walkway. The bathroom is one of the more challenging rooms in the house to navigate following surgery. Therefore, it should be evaluated and arranged for safety and maneuverability before surgery. First, the bathroom mats should be removed to prevent tripping and falling. Then, there is the added trial of the bathtub or shower. Following surgery, you will be advised against sitting in a bathtub, and you may be uncomfortable standing while showering. For these reasons, you may consider installing a shower chair or tub bench. These make stepping in and out of a bathtub much easier and offer the added benefits of safety and comfort while showering. As an additional safety precaution, grab bars and non-slip tape can also be used to help you maneuver in and out of your shower space. Getting on and off the toilet can also pose a challenge following surgery. To make this process easier, grab bars can be installed, or you can use a commode or a toilet riser with handles. If your bathroom will fit a commode, please ask Coordinated Health's physical therapists, and they will provide you with one for your home. If your bathroom is small, or you would prefer to use a toilet riser, one can be purchased at a drugstore prior to surgery. Keep in mind, a wet floor is slippery. Take your time when showering and be safe. If you think you may need assistance, ask someone for help. Negotiating stairs following surgery may be intimidating. Rest assured, your physical therapy team will teach you how to negotiate stairs during your hospital stay and will tailor your training based on your home. For these reasons, we ask that you make note of the steps to enter your home and the steps within your home. When you are seen by physical therapy in the hospital, they will ask you how many steps you have and whether the handrail is located on the left or right side. This information will be used to design your training. If you have a two-story home, you may consider setting up temporary rooms. For example, if your bedroom is on the second floor, you may want to set up a temporary bedroom on the main floor. Similarly, if your only bathroom is on the second floor, you may want to set up a commode on the main floor. It is okay to limit how often you use the steps until you gain more confidence negotiating the stairs. You will likely leave the hospital using a walker. If you have more than 1 or 2 steps at home, you will need assistance carrying your walker up and down the steps. It is also recommended that you have a family member or friend with you to practice taking the stairs. Please know that you will not hurt your knee by going up and down the stairs. While you may choose to limit how often you negotiate the steps, you are not restricted to staying on one floor. Our therapy staff will create a safe plan for you to maneuver throughout your home. Until your incision is completely healed, have another family member or friend tend to litter boxes and pet toileting, as they can increase your risk of infection. With these few simple adjustments, your transition home can be made easier for you and your loved ones. The suggestions reviewed in this video aim to help you move safely and have a successful recovery at home.